Mr. President, I ask that the quorum call be vitiated.
Without objection.
I ask unanimous consent that I be allowed to speak as if in morning business for up to 15 minutes.
Is there objection? Without objection, so ordered.
Thank you very much, Mr. President. Mr. President, I come to the floor again today as someone who has practiced medicine in Casper, Wyoming, taking care of families there since 1983. And I come also as the medical director of the Wyoming Health Fair, someone who's brought low-cost blood screening to people all around the state of Wyoming, looking for ways to help people with early detection of medical problems, whether that's high blood pressure or diabetes or cancer, because early detection means early treatment so often. As a result, longer survivability, better care. So I come today with a doctor's second opinion about the health care law, the law that has been signed by the President a little over 100 days ago. And the goal, of course, of health care reform was to lower the cost of care, to increase the quality of care, and to increase the access to care around the country. But since this bill has been signed into law, we hear week after week of new unintended consequences. We hear of personal stories of people who have been affected because of the law, the people whose lives are made worse because of the law, people whose lives have been impacted by the unintended consequences of the law. And during the entire debate, I was concerned that if this did pass and become law, that it would be bad for patients, those relying on our health care system, bad for providers, the nurses and the doctors of this country who take care of those patients, and bad for payers, because I believe that the law would drive up the cost of care, make insurance more expensive, and also impact on the taxes that people would pay. So I come, as I have each week, with this doctor's second opinion of things that have happened in the past week, things that we have learned new about the health care law or what's happening with trying to provide health care to so many Americans, but also people worldwide. Because as part of the discussion of this health care law, there was a discussion about the Canadian health care system, the British health care system. And we now have in charge of Medicare and Medicaid for this country someone who has said he's in love with the National Health Service, which is the British health care system. So, Mr. President, I come to the floor today having come across an article in a paper in Britain, the Sunday Telegraph. And the headline, because they have their national health system, a system that some in this country hold up as a model. It's a system that I look to as one that results in people having care delayed, care denied. When I look at survivable patients after, say, cancer in the United States, we know that patients with cancer survive longer in the United States than in Britain or in Canada, not because our doctors are better, but just because people receive more timely care. So this article in the, and I ask unanimous consent to put this in the record, Mr. Chairman.
Without objection, so ordered.
Mr. President, thank you. It's from the Sunday Telegraph, and it's the headline is "Axe Falls on NHS, National Health Service Services." This is dated July 24th, and it says some of the most common operations including hip replacements and cataract surgery. Well, I'm an orthopedic surgeon. I've done many hip operations. But in England, most common operations, hip replacements, cataract surgery, it says will be rationed as part of attempts to save billions of pounds despite government promises that frontline services would be protected. It says patients groups have described the measures as astonishingly brutal. These are patients groups in Britain. An investigation by the Sunday Telegraph, it goes on to say, has uncovered widespread cuts planned across the National Health Service, many of which have already been agreed by senior health service officials. That's within the system. They include restrictions on some of the most basic and common operations, hip and knee replacements, cataract surgery, orthodontic procedures, plans to cut hundreds of thousands of pounds from budgets for the terminally ill, the closure of nursing homes for the elderly, a reduction in acute hospital beds, including those for the mentally ill. It goes on, thousands of job losses in National Health Service hospitals, including 500 staff, to go at a trust where cancer patients recently suffered delays in diagnosis and treatment because of staff shortages. They're cutting 500 more staff positions there. It says the Sunday Telegraph found details of hundreds of cuts buried, as they tend to do in legislation, buried in obscure appendices to lengthy policy and strategy documents published by the trusts. In most cases, it says, local communities appear to be unaware of the plans. When you go on in this article, it's very disturbing, and if I were living in Britain, I would be very disturbed. And as someone living in the United States, with now a new person in charge of Medicare and Medicaid who has a position that he loves what's happening in the British healthcare system, I have great concerns. It says, as well as sending more patients home to die, the paper said the savings would be made by admitting fewer terminally ill cancer patients to hospital because they were struggling to cope with symptoms such as pain. Instead, it says, more patients would be given advice on, quote, self-management of their condition, essentially telling them to go it alone. Very disturbing words, very disturbing situation now in Britain. So next you have the article that appeared in Tuesday's New York Times. So yesterday's New York Times, settling down to a new job but hampered by old words. An article about the new director of Medicare and Medicaid. And this article by Robert Pear talks about the fact that the new administrator has never had a confirmation hearing. Never had a confirmation hearing, never had to respond to the American people through Congress to the questions that the American people have about the person who is newly in charge of Medicare or Medicaid, especially when you see the hundreds and hundreds and hundreds of billions of dollars that is spent every year by Medicare and Medicaid. The article says he never had a confirmation hearing and has not responded publicly to critics. It goes on to say the White House has declined to make him available for an interview. Now, amazingly, the budget, and we hear so much about the Pentagon and the military budget, but amazingly, the budget of Medicare and Medicaid is larger than the budget for the Pentagon. So here we have a newly appointed, in a recess appointment, someone who is in charge of Medicare and Medicaid at a time when this Congress, through its action and the law signed by the President, cuts $500 billion from our seniors on Medicare, and does it without having someone come and explain to Congress how he plans to keep the quality of care up, or try to keep the quality of care up, at a time with such cuts, not to save Medicare, but to start a whole new government program. Well, Dr. Berwick, it goes on to say, has received an honorary knighthood from Queen Elizabeth II in 2005 because of his love of the British health system. As a matter of fact, they even quote him here in the New York Times article, saying, I am romantic about the National Health Service, he says. He says, I love it. Well, the other thing that is so interesting at this time in the history of the United States, we now have someone in charge of Medicare and Medicaid who says that any health care funding plan that is just, equitable, civilized, and humane must, and then he repeats the word must, redistribute wealth. Redistribute wealth from the richer among us to the poorer. So it is no surprise, Mr. President, that just this week, in a report out Monday, 58% of Americans in a Rasmussen poll favor repeal of the health care law. 58% of Americans favor repeal of a law that was forced down their throats, with people around the country saying, no, don't do this to us. We don't want to go in that direction. But this Congress, this body, felt that it knew more than the American people. Now, I talked a little bit about the British health care system now. People also look to Canada, whereas the President said to us when we had our roundtable discussion in January, the summit at the White House, well, he said everybody in Canada gets coverage. Well, there's a big difference between coverage and care. And it's interesting where things are turning in Canada. It's in Regina, which is the birthplace of Canada's socialized health care system. That's where in 1962 the bill was passed and the law was signed for a government-run health care system. Well, now the health care plan there is contracting out CT scans to the private sector, they're contemplating private reforms because the government system is failing. Some people say, but in Canada, everybody has a doctor. Well, according to the Canadian Medical Association, this report shows 4 million to 5 million people still don't have a family physician. Now, by the government's own standards in Canada, and that's a government, and those are standards where they are used to waiting in line, where they expect long delays. Even according to their own standards, they're saying the Canadians are now waiting too long for care, and this is even after massive increases in spending. They go on to talk about how much better the care is in the United States in terms of surviving cancer, surviving heart attacks, surviving transplants, because in America there's greater access to preventive screening tests and higher treatment rates for chronic illnesses. So Canada is rethinking their system. Britain, who has announced that they're rethinking their system under the new prime minister there and the new government, and they're cutting significantly more, brings us back to Dr. Berwick, who said the decision is not whether or not we will ration care. The decision is whether we will ration with our eyes open. So it is no surprise that many people across this country view this nominee the same way that a former nominee who received a recess appointment was viewed. And I'll quote at the time Senator Obama when he was talking about a recess appointment made by then President Bush. He talked about the appointee saying, he's damaged goods, he'll have less credibility, which gets back to that New York Times headline, settling down to a new job, but hampered by old words. Now, does the public deserve a hearing for this Medicare appointee? Does the public deserve a hearing? Do they have a right to hear what this man has to say? Well, according to the Washington Post, in a headline of their July 23rd editorial, the public deserves a hearing for a Medicare appointee. This goes on and it says, a move to sidestep the Senate. President Obama said in explaining his move to sidestep the Senate and use a recess appointment to instill Donald Berwick to run Medicare and Medicaid, he had some reasons. But they go on to say Mr. Obama's hurry would have been more understandable had he not waited for more than a year to select an administrator. Now the President has resubmitted Dr. Berwick's nomination, as is the general practice here, and those members of this body, and specifically those on the Senate Finance Committee, they want, and they have made a reasonable request for a confirmation hearing. Still, none has been planned. It is interesting because the American people still want to know more about this nominee, what his beliefs are, and what we have to go by are the quotes, and I've gone through a number of them now. The question comes also to what questions does Dr. Berwick not want to answer? And when one looks into the history and the past, you'd say, well, he's a doctor, he's going to be involved with health care, he's going to likely have to live under the system with Medicare and Medicaid. I'm sure he's not going to establish something that's going to impact his health personally, but that gets back to the source from where Dr. Berwick has come. It turns out Dr. Berwick doesn't need to worry about those things, and he doesn't have to deal with the anxieties that the rest of America deals with, created by limited access to care and the extent of coverage. And I'm reading now from an article from the Examiner, that says, as it turns out, Dr. Berwick does himself not have to deal with the anxieties created by limited access to care and the extent of coverage. It goes on to talk about a special benefit conferred on him by the Board of Directors of the Institute for Healthcare Improvement. That's where he came from. It goes on, a nonprofit healthcare charitable organization, nonprofit healthcare charitable organization that he created, nonprofit healthcare charitable organization that he created and which he served as chief executive officer. He and his wife will have health coverage, quote, from retirement until death. And he has now retired to come work for the government, to be the head of Medicare and Medicaid. And according to page 17 of his employment contract, under post-retirement health benefits, health care coverage from retirement until death. Well, it's not, how many others can look for that sort of a benefit who are working for nonprofit charitable organizations? Maybe he doesn't want to answer those questions. The Senate has a right, and the American people have a right to ask the questions. And I've also found it interesting that for somebody at a nonprofit charitable organization, that benefit of health care from retirement until death went along with the salary that he earned, his compensation in 2008, $2.3 million. $2.3 million in a nonprofit charitable organization. I think it's reasonable for people to want to ask the questions. Where did the $12 million in contributions come from? Where are the grants? How did it come in? What impact are those people going to have and try to have on you as you work on rules and regulations in Medicare and Medicaid? Those are reasonable questions that the American people would want to have answered, and yet we don't have the answers. Mr. President, as a doctor, I go home every week, visit the people in Wyoming, and visit with doctors and nurses and patients. And one of the things that strikes me is a last report that talked about side effects. Obamacare, it says, could punish docs for better quality care. And that's what I hear about the most at home from doctors who are taking care of their patients and saying, I do a good job, I do everything I can, and yet the rules and regulations are going to punish me for doing what I know is right for my patients. And part of that are rules and regulations that are coming out of Medicare and Medicaid, and the Secretary of Health and Human Services who's developing these with financial incentives dealing with patient outcomes. And one of the things they want to do is punish people, punish physicians, hospitals, by penalizing them if a patient returns to the hospital after they've been discharged within a certain number of days. One of the finest hospitals in this country is the Cleveland Clinic, specifically with relating to heart conditions. And people from around the world, kings, sultans, queens, come to the Cleveland Clinic. Some fly in their private jets. Why? Because of the quality of care at the Cleveland Clinic. Very understandable. So it's interesting when the Cleveland Clinic took a look at their numbers to see how they are likely to do under the scenario that the Secretary of Health and Human Services says is the way to improve care in this country. The clinic has found that, and it has to do with people with heart failure, people who are being readmitted to the hospital, patients with heart failure. Now, it's considered to be a sign of poor quality care when a heart patient must be readmitted for further treatment. What the clinic did is they studied their readmission rates, and they found that their readmission rate in a 30-day period was actually much higher than the national average. So they must not be a very good hospital, according to the Secretary of Health and Human Services, because that's how they're being judged. But when you look at the Cleveland Clinic in terms of how the patients do, how many live for much longer, what we find out is that the survivability of the patients at the Cleveland Clinic is also much longer. More people survive. The results are better. So if you're a patient with heart failure, you want to go to the Cleveland Clinic. If, on the other hand, you're somebody who works at Health and Human Services and is just keeping the records, they're going to say, you don't want to go there, because some people come back into the hospital. Once again, we have a situation where government is saying one thing, and people, doctors, nurses, patients, families know that the government is wrong, and we should trust the doctors to make the right decision. So that's why, Mr. President, I return to the floor today to say it is time to repeal and to replace this health care law. We need a patient-centered health care bill. We need to replace anything that is either insurance company centered or government centered and be patient centered. We can do that by allowing patients to buy insurance across state lines, to give people who buy their own health insurance the same tax breaks that the big companies get, by providing individual incentives for people who stay healthy, take preventive measures, lose weight, get their diabetes under control, get their blood pressure down, quit smoking. Provide those incentives because that will lower the cost of care. We need, Mr. President, to deal with lawsuit abuse and the expenses of unnecessary tests provided by doctors practicing defensive medicine. And we also need to allow small businesses to join together to buy health insurance much more effectively. Those are the things that will work to get down the cost of care, to increase the quality, and increase the access. So that's why today, Mr. President, I offer my second opinion. It is time to repeal and replace this health care law. Thank you, Mr. President, and I yield the floor.